Welcome back, everybody. I'm just going to go through the schedule with kind of where we're headed. Tonight we'll do chapter 23, blood vessels. You have some heart pages, blood vessel pages. If you ever want to see the right answers or see the posted pages, just let me know and I'll post those under the file section. Specifically, I'll post the blood typing pages. Your Lab 4 exam will open up on Thursday at 7 p.m. We won't have any lecture that night. This lab exam, I've made 100 questions and they're all matching. So I know that's a lot more questions. I recently found out how to moderate the quizzes and see who's looking away from their Canvas screen, which probably won't deter many people from doing so. So I'm not trying to make it harder. I'm just trying to make it harder, I guess. So it's still worth 50 points, but there'll be 100 questions. It's all matching or multiple choice. You have pages there due. Next week will just be live lectures on respiratory, digestive, and then we'll get to kind of our final lab quiz the following week. So we're really kind of coming down to the wire here and we're ending quickly. Any questions on any of that? Otherwise, we'll start the chapter 23.
Professor?
Yeah.
So there's 100 questions. It's the same amount of time?
I think I gave you 90 or 120 minutes.
Okay.
I can change it. I'll give you a little more time. Yeah, it's some of the questions repeat themselves. You'll see what I mean. It was easy to come up with 100 questions because there's a lot on this exam. So yeah, I didn't do that to scare you. I'll give you some more time. Does that make you feel better, Hannah? I'm sorry.
Oh, that's okay. No worries.
Okay, so maybe you have your notes in front of you. We'll do chapter 23, blood vessels, and we'll start here. We'll go a little bit over their anatomy. We'll talk about blood pressure, systemic versus pulmonary circulation, and then how the cardiovascular system ages. So let's talk about the anatomy of blood vessels first of all. We'll talk about arteries and veins, but in general, we'll talk a lot about systemic circulation and pulmonary circulation. And it's good to have a good handle on what those both mean. Systemic circulation extends to all body regions, and pulmonary circulation only consists of arteries and veins that go to and from the lungs. So just keep those in your mind as we're going through this. And those are your first two blanks on number 1 in your notes. Arteries always carry blood away from the heart, and arteries will become smaller as they branch and lead to capillaries. So those are right directly from your notes. Arteries normally carry oxygenated blood, except in one instance when they're the pulmonary arteries that are carrying blood to the lungs to pick up oxygen. Veins return blood to the heart or towards the heart, and veins become progressively larger as they merge and approach the heart. And the veins will eventually merge and approach the heart as the superior or inferior vena cava, entering into that right atrium. The word anastomosis is whenever 2 or more vessels converge. Veins will anastomose with each other more than arteries will, and end arteries that just stop kind of in the tips of your fingers, those do not form any anastomoses. And then a companion vessel are arteries and veins that lie next to each other. And we'll see several examples of companion vessels. The femoral artery and vein in your leg, kind of in your quadricep region, that's an example of a companion vessel, an artery and a vein that lie right next to each other and they have the same name. Okay, so walls of arteries and veins all have 3 layers and we call them tunics. The tunica intima is composed of endothelium, which is simple squamous, and a subendothelial layer of loose areolar connective tissue. So I'm just going right down your notes here. The tunic media is a middle muscular layer of these blood vessels. Sympathetic activity always affects this layer because it will cause those smooth muscles to contract. And when those smooth muscles contract, they'll make the blood vessels, the diameter, smaller. So we call that vasoconstriction. And that will lead to an increase in blood pressure, which is helpful if you've ever been in an accident and you're internally bleeding. The sympathetic activity will go to this layer of smooth muscle and cause vasoconstriction. And then the tunica externa is the outer connective tissue layer that helps anchor blood vessels to the surroundings. Capillaries are the smallest of the blood vessels, and they have the thinnest walls. They only have what we call the tunica intima, and capillaries are where all nutrients, gas exchange will occur. So the oxygen will be offloaded here into the surrounding tissue, and it'll pick up carbon dioxide and take it back to the lungs. So this is a picture look of the difference. You'll probably notice right away that arteries have much larger tunica media, those muscular layers. Veins are a lot thinner. Their walls are a lot thinner. Veins are more collapsible, so they can collapse more easily, and arteries kind of withhold their shape a little bit better. So basically, your arteries carry blood away from the heart, eventually to capillaries, where all the nutrients and gas exchange occurs. And then on the other side of the capillary is where the vein hooks up, and the veins carry blood back to the heart. Also in veins, we'll talk about why they have these valves. And the valves just help, especially in your legs, the blood to get back to your heart. The valves kind of keep the blood from going back down and pooling in your feet. So the valves help keep blood going back up to your heart. Another look, a histological look at arteries and veins. You can see how veins are much thinner and arteries have that thick muscular tunica media wall. Okay, so when we talk about the lumen diameter, that refers to the area in the middle, the lumen. The arteries are much narrower because they have a thicker wall thickness. The thickest layer in arteries is tunica media. There's more elastic and collagen in arteries so that they can stretch and withstand some of that pressure that's being forced through them as the ventricles contract and eject their blood. And the blood pressure is usually higher in arteries than in veins. This tells you oxygen levels, and then it goes through some veins too. Okay, let's keep going here, and we'll get into the types of arteries in a second in your notes. As we look at arteries and veins, there's different sizes of arteries and veins, and they all have different names. So the largest of the arteries are the elastic arteries, and those are the ones that come directly off the heart. They will get a little bit smaller into muscular arteries. Muscular arteries is the size of the arteries that makes up the majority of our arteries throughout our limbs and our abdominal thoracic region. The arterioles are the smallest of the arteries, and the arterioles eventually connect into capillaries, which will connect up into venules, which are the smallest of the veins. Venules turn into small or medium-sized veins, and then into large veins, which would be a superior or inferior vena cava. Okay, let's take a quick review break here. What circulation consists of the blood vessels that takes the blood to and from the lungs for the purpose of gas exchange? Is that pulmonary or systemic?
Pulmonary.
Oh, I'll say pulmonary.
Pulmonary?
The key word is lungs here. So whenever you see the word lungs, think pulmonary. So blood to and from the lungs is pulmonary circulation. And then what are the three classes of blood vessels? Arteries, veins, and?
The capillaries?
Capillaries, yeah. Arteries, veins, and capillaries. And then what is a term that describes an artery and vein that travel together and supply the same body region? A companion blood vessels. Good job. It's easier to review when we're all in class, isn't it? Whoops. Okay, so these are the three types of arteries transporting blood away from the heart, and we'll go through these now in your notes. The elastic are the largest arteries. They contain a lot of elastic fibers to just allow them to stretch. during ventricular blood ejection. Most examples are near the heart, so your aorta, your pulmonary artery, and your brachiocephalic arteries, and we'll talk about what those are. These arteries will branch into smaller muscular arteries. So that is your first type of artery. The big ones are your elastic arteries. Then your medium-sized arteries are your muscular arteries. They possess elastic fibers in two kind of rings that surround them. Muscular arteries have a proportionally thicker tunica media with many layers of smooth muscles. And again, like I said before, most of our named arteries are muscular arteries. So we'll talk about where your brachial artery is, your anterior tibial, your coronary, and muscular arteries branch into the smaller arterioles. So those are muscular arteries. The smallest of the arteries are the arterioles. The number of layers and thickness of their walls can vary between larger and smaller arterioles, and sympathetic innervation to muscle fibers of their tunica media causes them to constrict or the diameters to get smaller. And this will cause elevating blood pressure upstream from where that constriction occurred and decreased blood flow to downstream capillaries. So this is a look at the three types of arteries and kind of the differences in their tunic layers. Okay, capillaries are the smallest blood vessels, and their diameter is only slightly larger than an erythrocyte. So just one red blood cell can get through at a time. They only have a tunica intima, and they allow for metabolic exchange between blood and tissues. So this is number 6, Roman numeral number 6 on your notes are capillaries. Nutrient and gas exchange occurs in them from blood to tissues, and they will pick up any waste products like CO2 and anything else that needs to be taken back to the heart. There's different types of capillaries. Continuous are the most common type. Their endothelial cells form a complete lining that are aided by tight junctions. So those are continuous, the most common type. That's number 1 in your notes. Then we have fenestrated in the sinusoids capillaries. Fenestrated, they have tiny pores that allow fluid exchange. And an example of where those are located are places where a lot of fluid exchange occurs in your small intestine and your kidney. And then sinusoids have large gaps between their cells and an absent basement membrane. So sinusoids just means that larger molecules and cells can get to and from the blood. And these examples of where this would be in your bone marrow and liver. So this is a little bit of an example of what they look like. Continuous really have no pores, the most common type. Fenestrated have tinier pores, and then sinusoid, you can see the larger openings in those capillaries. Okay, the space within a vessel through which blood flows is called the lumen. The 3 wall layers of arteries and veins are the tunica intima, media, and tunica externa. What arteries carry deoxygenated blood to the lungs? The pulmonary arteries. And the smallest type of artery is the arteriole, and the smallest blood vessels in the cardiovascular system are the capillaries. Okay. And then we get to veins. They drain capillaries and return blood back to the heart. Pressure in veins is much lower than in arteries. So in Roman numeral number 7 in your notes, blood pressure is lowest just in the veins. That's all we're asking there. And then the little letter A, if you're following in your notes, that should be valves. And we'll talk about a little more in detail what valves do. At rest, veins hold about 60% of your body's blood. So that's just where your blood is hanging out. So we call them sometimes the blood reservoirs. Venules are the smallest veins. So these ones are connected right to your arterioles. They are companion vessels with arterioles. You don't need to know really anything else. The venules will merge to form smaller to medium-sized veins. And these travel with muscular arteries, so those are their companion vessels. Large veins travel with elastic arteries, and this is where we talk about valves. Because the blood pressure in veins is so low, most veins contain these valves to prevent pooling. So the valves are formed from that innermost tunic, the tunica intima, just so that when blood does get above a certain point, the valve closes off so the blood stays up where it is and it doesn't fall back to your feet and stay there. Muscles also help in pushing blood back to your heart. When they contract, they squeeze the veins and kind of squeeze the veins like a Go-Gurt to push the blood also back to your heart. And we call that the skeletal muscle pump. Venous return back to the heart is also assisted by the respiratory pump. So changes in your intrathoracic and intra-abdominal pressure, just by breathing in and out will help, that difference in pressure will help venous return back to the heart as well. So here's a look at your skeletal muscle pump, how the skeletal muscles will squeeze and just push blood up through veins. And when blood gets above a certain point, the valve will close to prevent backflow back down. So another good thing about exercise is it contracts your muscles and just helps the blood to return back to your heart faster. And this is a look at how the respiratory pump, the changes in pressure, also compress and release compression on the inferior vena cava to help kind of suck blood back up to the heart as well. Okay, so then we'll talk a little bit about blood pressure. It's the force per unit area that blood places on the inside of a blood vessel. You'll talk more about this because it's more of a physiological concept. Many of you probably know how to take blood pressure. It's measured with a sphygmomanometer, which is the fancy word for the blood cuff that inflates. We call systolic blood pressure the pressure when your ventricles contract, and diastolic blood pressure is the pressure during ventricular relaxation. Your blood pressure is pulsatile, so it beats, or it pulses as your heart beats, and it decreases from the aorta to the vena cava. So here's a look at your systolic versus diastolic pressure and those numbers, how they're highest within the aorta and arteries, and how they really fall off and decrease as they get back to your superior and inferior vena cava. 120/80 is normal blood pressure. Anything above that would be considered pre-hypertension or hypertension after a certain point. And hypertension is just a fancy word for an increase in blood pressure. So I'm just seeing the chat. I updated my Zoom and it didn't pop up until now. Okay, so some more review. The veins in systemic circulation carry deoxygenated blood to the right atrium of the heart. At rest, about 60% of blood is held within the veins, which function as the body's blood reservoirs. The companion vessels to the arterioles are the venules. And blood pressure increases when sympathetic innervation causes vasoconstriction of the arterioles. And diastolic pressure, which is the lower number in blood pressure, is the pressure in the vessel during ventricular relaxation. And now we're going to look at the three main arteries that emerge from the aortic arch and what veins empty into the superior vena cava. And this will help you go through now we'll kind of look at some of the blood vessels. First of all, we're just going to go back to number 8 in your notes. What do you think increased cardiac output will do to blood pressure? Will that increase or decrease blood pressure? What do you think? You're close, Enrique. Increase it. So as your cardiac output, that just means the amount of blood that your heart ejects. If more blood gets ejected, that'll increase blood pressure. So increased cardiac output will increase blood pressure. Okay, so now we're going to get into some of the naming of these arteries, which is kind of helpful with lab too. I wanted to go over this, and I zoomed in on this picture first of all, because the blood vessels exiting the aorta can be a little tricky. If you're looking here, I wish I had a heart model. I should just invest in them. But coming off of the aortic arch, there's three main branches. And the first main branch coming off of the arch on the right side, right anatomically, is the brachiocephalic trunk. And the brachiocephalic trunk eventually branches into a right common carotid artery, which will go up the side of your neck on the right side, and a right subclavian artery. And the subclavian arteries always go to your shoulders. So these three main branches off of your aortic arch will supply blood to your head and to your upper limbs. Otherwise, the descending aorta takes all the blood that the lower half of your body needs. But these three main branches, you should know the naming of them. The middle branch off of the aortic arch is the left common carotid artery. And the left common carotid artery goes up the left side of your neck. So your common carotid arteries, whether right or left, are the ones that go up the side of your neck. And then the left subclavian, the third branch off of the aorta, goes to the left arm. So those are the three main branches off of the aorta. And then we'll talk about the branches off the superior vena cava too. So number 9, Roman numeral number 9 on the back side of your notes, what artery bifurcates? Bifurcates means to split into the right subclavian artery and the right common carotid artery. That would be the brachiocephalic trunk.
What number did you say that is?
So that's number 9, Roman numeral number 9, the first one at the top of the second page.
I'm sorry, so can you repeat that? You said it will be the
brachiocephalic trunk.
Okay.
So the brachiocephalic trunk is this first branch off of the aorta, and that'll branch into the right common carotid and the right subclavian artery. The left common carotid and the left subclavian are their own separate branches, but the brachiocephalic trunk is the one that will bifurcate into those two. Whenever you see the word trunk naming an artery, that usually means that it will eventually branch into 2 or more arteries really soon. We'll talk about the celiac trunk when we get there. Okay, so brachiocephalic artery. So here's a look at all of your systemic arteries, and you can see how I kind of zoomed in on this picture on the bottom right just now. We'll talk more about the blood supply to the upper and lower limbs. I'm going to focus a little bit right now on the blood supply just to the arm. As we're looking at the arm, my cursor's on the right subclavian artery right now. And the right subclavian artery, all it does is it changes names as it moves down your arm. So the right subclavian, when it gets into your axilla region, which is your armpit, it changes names to the axillary artery. And after it passes the inferior border of your teres major muscle, which is just kind of in the upper arm, it becomes the brachial artery. And then the brachial artery, and again, there's branches that come off of this that you don't need to know, but I'm just focusing on the ones that you should focus on for lab. The brachial artery then eventually branches into a radial artery, which, like everything, travels along the lateral side of your forearm, which is where your thumb would be, which is where your radius bone is. And the ulnar artery will travel along the pinky side, the medial side of the arm, where your ulna bone is. Eventually, these arteries form an arch in the palm of your hand, and then they go out to the tips of your fingers. So that kind of nomenclature and sequence of blood flow, it goes from subclavian to axillary to brachial artery. And the brachial artery splits into radial and ulnar. And the same thing happens with veins. So it's a similar nomenclature for veins in the upper limb. We will zoom in on the descending aorta in a couple other slides. So systemic veins, I'm going to draw your attention to this picture on the bottom screen coming off of the superior vena cava. The superior vena cava will bifurcate into a right and a left brachiocephalic vein. So the right and left brachiocephalic vein will merge and form the superior vena cava. We'll answer your note for number 10 in a little bit too. And then the veins branch in a much similar way. Once they get away from the heart, we get your subclavian vein, axillary vein, brachial vein. You might have two brachial veins going next to each other, but ulnar and radial veins will be on the ulnar and radial side of the forearm too. Okay, so we're going to talk a little bit about blood flow leaving the heart. So this is kind of what I just explained. Oxygenated blood is pumped out of your left ventricle into your ascending aorta. The right and left coronary arteries bring blood to the heart, and 3 arterial branches emerge from the aortic arch. And those are the 3 branches that we just talked about. The brachiocephalic trunk, which will split into your right common carotid and right subclavian, and then your left common carotid and left subclavian branch. The descending thoracic aorta will follow the aortic arch down, and several arteries will emerge to the thoracic wall, providing the muscles in your ribs. It changes names to your descending abdominal aorta after it passes through the diaphragm. And then at your 4th lumbar vertebrae, because you have legs and feet that need blood supply, your descending aorta splits into a left and a right common iliac artery. And your left and right common iliac artery then go down your legs to supply your legs with blood. The common iliac arteries further divide into an internal and external iliac artery, which I'll show you a picture of. The internal iliac artery supplies your reproductive organs, everything in your lower pelvic region. And your external iliac artery stays along kind of the external side and becomes the femoral artery as it changes names and goes down to your leg. And I'll show you another picture of that as we get a little further on. Actually, I'm just gonna go back to this picture so I don't miss it. So here's your descending aorta coming down. Your descending aorta splits into the right and left common iliac. So that's the first naming of the splitting off your descending aorta. Your common iliac arteries, you can see where there's a major split again, where it splits into the internal iliac artery and the external iliac artery. Your external iliac artery continues down your legs, and it will change names into the femoral artery. Once it gets past the inguinal ligament, which is a ligament around your pelvic bone. And then we go through the veins, and it'll talk us through the superior vena cava, again, splitting into right and left brachiocephalic veins. Your brachiocephalic veins, purely talking veins now, will eventually split again. The brachiocephalic veins will split into an internal jugular vein and a subclavian vein. And I know this picture is not the best. And normally I would take this time in class to show you a picture. Let me get back to the notes and then I'll come back to that. So that your superior vena cava is formed from a fusion of the right and left brachiocephalic veins, and the inferior vena cava will return all blood to the right atrium from everything in the lower limbs. The left and right common carotid arteries, remember those were the ones that went up the sides of the neck. At the superior border of your thyroid cartilage, they will divide into external and internal carotid arteries. And this, I'm going to show you this here. So this is a look at your brachiocephalic artery. So we're on the right side of your neck. And here's your right common carotid coming up the side of your neck. And right at the place, this is your thyroid cartilage, you'll see a branch, your internal carotid artery will go into your skull, and it'll go through that carotid canal And the external carotid artery will continue off and branch to branches of arteries along the exterior surface of the skull. So that's what this picture is showing. Your common carotid artery going up the neck, and then at the location of your thyroid cartilage, it branches into an internal carotid, which will disappear inside the skull. And the external carotid will continue on to the surface of the exterior of the skull. Then we get to arteries in the head and neck, and I don't have you guys know these for lecture, or I don't think any of these are on lab at all. Just showing how that external carotid artery provides blood to several different branches. They're important because these are blood branches that will go to your tongue, muscles of facial expression, occipital artery. These are going to your eye or to the back of the head. Posterior auricular artery will go behind your ear, but you don't need to know those branches. Venous blood return is through the internal jugular vein and the external jugular vein. And these two veins drain into your subclavian vein and then into the brachiocephalic vein. So I'm just going to show you a picture, a little bit of how blood flow is returned from the head and neck. And this will help answer Roman numeral number 10 on our notes. So I like to start down below from where we would get to the heart. The right brachiocephalic vein is right here. Remember, your right and left brachiocephalic veins form your superior vena cava, and your right brachiocephalic vein will branch into an internal jugular vein, which will go up the sides of your neck. And the subclavian vein is the other branch that continues on. The external jugular vein, you can see here is a branch that comes off later on the subclavian vein. But the internal and external jugular veins do a similar situation as the internal and external carotid arteries. One will go to the inside of your skull, to the brain, and the other has branches that stays on the surface. But your answer to Roman numeral number 10, it's asking for what forms your brachiocephalic veins. And in terms of which veins will merge and form into your brachiocephalic veins, the answer, if we look right here, the first branching off your brachiocephalic vein, one is your internal jugular. So that's one of the veins. So internal jugular. And the other branch that is right there is your right subclavian vein. So the internal jugular and the subclavian veins will form the brachiocephalic vein. Okay. Here's a cadaver look at your subclavian vein and internal jugular vein. Again, you can see the external jugular vein comes off your subclavian a little bit farther down. Okay. So I'll try to keep this not too heavy because I know there's a lot of arteries. Moving forward, again, I just would encourage you guys to only study your notes for lecture exam because there's just going to be a lot of arteries in here. And I'll try to focus on important ones to know for the lab exam on Thursday. From your subclavian arteries, which again, whenever you hear the word subclavian, whether it's an artery or a vein, think of the subclavians go to your shoulders. These are giving off blood supplies to your abdominal walls and to anterior intercostal arteries. So we're looking at arteries that will supply blood to the superior abdominal wall, intercostal arteries, which are arteries that go between ribs. The inferior epigastric artery is another branch off of your external iliac artery, and that will also supply blood to the inferior abdominal wall. So let's take a look at this picture. I'm going to focus on, so as we see our descending aorta coming down, it changes names from the descending thoracic aorta to the descending abdominal aorta once it passes through the diaphragm. And I just want to point your attention off to three major arteries that come off the front of it in the abdominal region. The first is the celiac trunk. So coming off the descending aorta, once you get through the diaphragm, the first major branch off the descending aorta is the celiac trunk. The second major branch, and I'm only looking, if you're looking at the descending aorta just from the front on, the second major branch is the superior mesenteric artery. And the last branch, the third and final, is the inferior mesentery. So we have a celiac trunk artery. Again, it's called a trunk because it branches into three others, which will supply your stomach, your spleen, and then your superior mesenteric artery and your inferior mesenteric artery. Those are the three you should know for your lab exam, and knowing them in that order. Celiac trunk is off first, superior mesenteric, and then inferior mesenteric. Coming off the sides of your descending aorta, you have arteries that go to your kidneys. And whenever you see or hear the word renal, that has to do with kidneys. So your left and right renal artery bring blood to your kidneys, and the veins will be similar. And the only two others that you need to know for your lab exam are your gonadal arteries. So you have a right and a left gonadal artery. So these will be also paired, and they will bring blood supply to the gonads. So the testes in males and the ovaries in females. So knowing those 5 major branches off the descending aorta, that's what I focus on in your lab exam: the celiac trunk, superior mesenteric, inferior mesenteric, and then the renal arteries to the kidneys and the gonadal arteries to the gonads. This is also a good picture of how your descending aorta splits into right and left common iliacs, and then how the common iliac splits into an internal iliac and an external iliac. And this picture shows where the inguinal ligament is, and after the external iliac passes underneath that inguinal ligament, it changes names into the femoral artery. Easy peasy, right? Maybe. I know it's not. But that's all you need to know. All of it. Not bad, I guess. So you have lots of other branches, and I'm going to go through these a little quickly because I won't ask you guys to know these. These are the veins now, but similar, the veins follow this very similar branching. So we'll go through the veins now, and we'll look at the veins off of the inferior vena cava. So the inferior vena cava, there's much fewer veins you need to know. Really, I only want you to know your renal veins, and those are veins that go to the kidneys. But the inferior vena cava will split and have the same nomenclature, naming system, as the descending aorta did. So your inferior vena cava splits into right and left common iliac veins. And again, your left and right common iliac veins split into internal iliac veins, which go into the pelvic region. So they'll supply and drain blood from your bladder, reproductive organs. And the external iliac vein will keep its name until it passes underneath the inguinal ligament, and it'll change its name to the femoral vein. So your femoral artery and vein travel along right side each other. They have the same nomenclature, naming. Quick story, if you're ever in a self-defense situation and you have a knife, which I don't know if many of us carry a knife around, they say to go for the femoral artery because not only does you lose, the person you're attacking will lose blood supply the quickest, but the femoral artery, when it's cut or severed, it kind of retreats back into the pelvic region. So it's really hard to cauterize it. I once had some like army medics in my anatomy class, and they were explaining if the femoral artery gets cut, you lose blood, but it's also really hard to cauterize it or like pull it back out to stop the bleeding. Mm-hmm. So a little self-defense lesson for you. If you have a knife in your purse, I don't know. I don't usually carry knives. I have hair ties and kids' toys. I don't know if you've ever done that. What's the craziest thing you found in your purse before? It's like I don't know if you're at a party, break the ice type game, which none of us go to parties anymore. So anyway, All right, I know. What else? Thoracic organs. I really I really hit on the main arteries that I want you to know, especially off that descending aorta, inferior vena cava, and then knowing how it splits as it goes through the limbs, you should know. You'll have bronchial arteries supplying the lungs, esophageal arteries. Your diaphragm will be supplied by different sources. I'm going to pass through some of these a little more quickly. Here are the unpaired arteries that come off of the descending abdominal aorta that I wanted you guys to know. The celiac trunk, superior mesenteric, and inferior mesenteric. These are the three branches off of the celiac trunk. So the trunk, again, it's called a trunk because it splits into three more branches. I don't believe you need to know any of these. There's a review question coming up which asks what the splenic artery supplies, and it'll supply the spleen and part of the stomach. So the nice thing about some of their names is that the name of the artery tells you what it supplies. The gastric artery, gastric will help supply stomach. Common hepatic artery, the word hepatic always has to do with liver. I don't think I have you guys know that. I'll check your study guide. So here are the celiac trunk and the branches and what it'll supply. It's just good to kind of see where everything's going and how your stomach gets blood, how the liver gets blood, how the spleen gets blood. Here's your superior mesenteric artery. So I want you to know that's the second branch off the descending aorta. Here are its branches, which you don't need to know. I just want you to be able to identify your superior mesenteric artery, much like the celiac trunk. Here are the superior mesenteric artery and its branches. Much of it goes to your colon, so your large intestine. And you can see here the inferior mesenteric artery is the last major branch coming off at the bottom, and it will supply the lower large intestine or the lower colon. So there's your inferior mesenteric artery and its branches. Then we get to the hepatic portal system. The hepatic portal system, this will be a test question. It's a network of veins that brings nutrient-rich blood from your digestive organs to the liver. That's all I want you to know. It's a system of veins that brings nutrient-rich blood from your digestive organs to your liver. So basically, when you guys eat food and the food gets digested in your stomach and small intestine, most digestion occurs in your stomach and small intestine. Everything that gets absorbed into the bloodstream goes through this hepatic portal system. Because your liver is the body's detoxifying center, so anything that gets absorbed from your food, this can be medication, it can be Tylenol. Tylenol is absorbed in your liver, which makes too much Tylenol bad for your liver. But the hepatic portal system is just the network of veins that carries all that recently absorbed nutrients from your food or medication to your liver for detoxifying. And then hepatic veins will take the blood from the liver after it's been cleaned out and return it to your inferior vena cava. So that's the hepatic portal system. Here's a look at the hepatic portal system, the big hepatic portal veins going into your liver. And again, you'll see this whole system of veins really connected to all parts of your digestive tract. It'll be attached to your stomach, your small intestine, and then your large intestine. So any place where absorption of food and nutrients is occurring goes through the hepatic portal system. Here's a cadaver view of it. I hope you guys get to dissect a cadaver at one point in your lives because you'll learn so much. It's kind of crazy, but once you get over that, you'll learn so much. And then these are the paired arteries that I want you to know. Don't worry about the suprarenal arteries. Those supply the adrenal glands, which just sit on top of your kidneys, but you should know the renal arteries and be able to identify them on a picture. Renal arteries and veins always go to the kidneys, and gonadal arteries will either go to your testes or your ovaries. More branches off of your internal iliac. Remember, your internal iliac will supply anything in the lower pelvic region. So your rectum, gluteal region, anything in the pelvic region. Here's how that common iliac artery branches into an internal branch and the external branch, which will eventually become your femoral artery. These are some more review questions. The blood vessel supplying branches to the abdominal wall. Those are the thoracic arteries, which isn't super important to know for me right now. The right and left brachiocephalic veins merge to form your superior vena cava. The three branches off of your aortic arch, which you should know again are if they come off like this, the one on the right side is your brachiocephalic trunk, your left common carotid, and your left subclavian. The veins of your GI tract all merge into some part of the hepatic portal system. And the hepatic portal system is that venous network of veins that drains your GI tract to shunt blood to the liver for absorption and processing of anything transported. And then the three major arteries coming off your descending aorta were the celiac trunk, your superior mesenteric, and inferior mesenteric. Okay, then let's talk about the sequence for arterial blood flow in the upper limb. This is your final question on your notes. The right and left subclavian arteries supply blood to your upper limbs. And your subclavian artery, once it passes your first rib, it changes names into the axillary artery. So that's kind of the next order of nomenclature that we have. And once the axillary artery passes your inferior border of your teres major muscle, it changes names to the brachial artery. So you should know this sequence for naming. It's really one continuous artery, but it's named differently depending on where it's located in the upper limb. In the cubital fossa, which is right kind of where your arm will bend, where your elbow is, your brachial artery will bifurcate or split then into ulnar and radial arteries. And I just want you to know that sequence of names. Eventually they'll branch and form anastomose with each other to form palmar arches, so kind of arches within the hand, and then arteries that will go to your fingers. So this is the arteries of the upper limb, and you should just know that nomenclature. Subclavian to axillary to brachial, and then radial and ulnar. Okay. In the veins, one thing, the venipuncture, where you would get commonly drawn for blood or give blood, is in the medial cubital fossa, and the median cubital vein is a common site for that. The veins branch similarly to the arteries, and I'll show you this picture here. So here's your median cubital vein, which is a common site, again, for drawing blood, or if you need an IV, if they don't go through the hand, but you'll have radial and ulnar veins. You can see that there's a lot more branches to veins as they're draining blood back to the heart, but radial and ulnar will eventually form brachial veins to axillary veins to subclavian veins. So the nomenclature is very similar.
Professor?
Yeah.
Why are those lighter than the other one? Is there a reason why or no?
Yeah, I think in this picture, the lighter ones are the superficial veins. And
okay. I see.
I just saw that myself, Hannah. That's a good question.
Thank you.
Mm-hmm. Yeah, you see things a lot differently when you're lecturing to your computer screen and not to a PowerPoint in front of class. Okay, here's a cadaver view. Vascular supply to the upper limb showing the radial and ulnar artery and some nerves in there as well. Then blood supply to the lower limb. We've talked about this in length as well, how your right and left external iliacs will supply blood to the lower limb. Once it passes underneath your inguinal ligament, it'll change name to your femoral artery. It'll have a branch called the deep femoral artery, which you don't have to worry about knowing for me right now. The femoral artery will enter behind the knee, and we call that the popliteal artery. So it just changes its name to the popliteal artery, which supplies the knee joint and muscles to that region. And then your popliteal artery is what divides into your anterior and posterior tibial artery, which will go to the anterior and posterior side of the leg. Then from here, we get into your feet. And I don't ask you any arteries in the feet. You'll notice some of these arteries are named for where you could probably find them. Plantar arteries, dorsalis pedis artery, digital arteries will extend to the toes. So you can kind of start to see again how anatomy has its own language. And once you learn it, you can really start to tell where the location of some of these things are. So here's your femoral artery going behind the knee, changing names into the popliteal artery. And then if you look at the posterior view, you can see the posterior tibial artery going on the back and the anterior tibia artery going on the front of the lower leg. The one vein that I want you to know, I put an asterisk next to it, I underline it, is the great saphenous vein. This runs along the entire medial surface of the lower limb. So it drains into your femoral vein, and the small saphenous vein drains into the popliteal vein. But the great saphenous vein is one vein that goes along the entire medial surface of your leg. More veins in the feet and ankles will drain blood from your feet and ankles, similar to the arteries, which I don't have you know too much until you get into your femoral vein, which will change names into the external iliac and then into the common iliac as it merges with and forms the vena cava. So if we take a look at this picture, working our way from the bottom up, we have your great saphenous vein running along the entire medial side of the leg. And then you can see here the femoral vein will merge to form or change its names into your external iliac vein, and your external iliac and internal iliac vein merge together to form your common iliac vein, and your common iliac veins on both sides of your legs will merge to form your inferior vena cava. Okay, so let's go over this. The external iliac artery provides the main arterial supply to the lower limb. The superficial vein that runs along the medial surface is your great saphenous vein. And which of the following organs are supplied by the splenic artery? You don't really need to know that one, but it's stomach and spleen. And the subclavian artery is renamed what artery after it passes over the lateral border of the first rib? So the subclavian artery becomes what?
Axillary artery.
Good.
Yeah.
Yep. Axillary, and then the axillary artery changes name to what?
Brachial.
Brachial artery. Good. And then brachial will split into radial and ulnar arteries. Okay. List the deep veins in order from distal to proximal. If we start at your fingertips, we would have digital veins will lead into superficial and deep palmar venous arches, which will lead into radial and ulnar veins, which lead into brachial veins, to axillary veins, to subclavian veins. So veins follow similar nomenclature to arteries. Which artery supplies the knee joint and muscles in this region?
Is it popliteal? I don't know.
Popliteal?
Yeah, I was gonna say that.
Popliteal, I guess you could say it. Yeah, anything goes. Yeah, popliteal. Then the external iliac artery is renamed the what after it passes under the inguinal ligament? Femoral. Yep. Thank you. Thanks, Enrique, too. Okay, let's finish up here. We're getting close, guys. Oh, just 4 more slides. All right. A little bit about pulmonary circulation. In their blood vessels, arteries carry deoxygenated blood and veins carry oxygenated blood. So this is the only instance in the body where the arteries, the pulmonary arteries, will carry deoxygenated blood, and the veins will carry oxygenated blood. Just a little bit about this. Deoxygenated blood, again, exits your right ventricle into your pulmonary trunk, and your pulmonary trunk splits into pulmonary arteries that go to the lungs, and then pulmonary veins return oxygenated blood to the lungs into the left atrium. We'll talk about this a little more when we get to respiratory system, which I think is next time. But this is just showing just a little bit about pulmonary circulation and how these pulmonary arteries will be shown in blue. And that's always confuses students because they don't have oxygen yet. And they'll wrap themselves around these structures called alveoli. They'll become little tiny capillaries where oxygen and carbon dioxide will be exchanged, and then oxygenated blood will return back to the heart via these pulmonary venules or pulmonary veins. Here's a look at pulmonary circulation and versus systemic circulation. I think we've seen a picture like this before. I'll let you guys review this on your own a little bit. What happens with our blood vessels as we age? They lose their resiliency. So because they're not able to expand and come back, blood pressure may increase because they aren't able to stretch out. Older individuals are more susceptible to an aneurysm. And an aneurysm is whenever a blood vessel balloons out. So they could lose their resiliency, or they could also just become too stretched out and they never come back. So you might find someone with an artery that's just ballooned out a little bit. That could possibly rupture. So you could have an aneurysm in your brain rupturing or in your descending aorta. Arthrosclerosis is also more common as you get older, and arthrosclerosis is just a buildup of plaque or kind of grainy material within your arteries due to probably poor exercise and poor nutrition. And that's all I have with that. So I'll stop the recording here. Any